Hi, everybody. I'm Carrie, and this is my practicum summary presentation. This is feeding your family in a respectful, healthy way. And this is a presentation that's sort of summing up the work that I did with Professor Matthew Little at the University of Victoria over the semester. And what we did was we evaluated two community food initiatives, and I'll talk about that more in a minute. Just a quick land acknowledgement, because I'm actually in Edmonton, Alberta, and I would like to say that we're very grateful to be here on Treaty 6 territory. This is the ancient homeland of many different groups who have lived here long before Edmonton was ever founded. And these include the Niitsitapi, Nehiyawak, Dene, Anishinaabe, Nakota Iska, and a variety of different Métis people. And I'm very grateful and happy to be here in Edmonton, even though it snowed this morning. All right, so my practicum is basically three components. The first is researching the problem. So through a lot of reading and guidance from my supervisor, I've gained a deep and nuanced understanding of food insecurity as a social determinant of health in Canada. I also worked on two community-based initiatives to do the evaluation. So that involved a lot of talking to people, making transcripts, and then going through the data. The third part is the qualitative data analysis. And this is the part where I went through all of the information that was gathered and really found ways to sort of add this qualitative data to really enrich our research, as well as open up new avenues for exploration. Okay, this is just a quick map because I'm talking about two different initiatives. People might want to know where they are. So the Vancouver Island Health Region, it's on the West Coast, and it's 7 sites across Vancouver Island. And the other evaluation was in Guelph, Ontario, which is just a little bit west of Toronto proper. All right, so the first evaluation that I'm going to talk about is the Transforming Tea and Toast evaluation. So this one is actually going on right now. Most sites started in March of 2020. The intervention here at the different sites consists of a good food box, which is fresh produce provided weekly or bi-weekly to participants. There's also an educational or skills component. Each site is doing a different one to find what works best for their participants. For example, in Victoria, they're doing vertical gardening, and this allows for more space in especially for people who live in apartments or condos. Other sites are doing initiatives such as interpretive nature walks, cooking classes, and some small scale farming. The population interest is seniors who are living with food insecurity. Seniors for us is an adult who is age 55 or older. And the part that I am playing in this evaluation is mainly to conduct the process evaluation, which is to talk to participants to find out their perceived facilitators and barriers to the program, as well as any perceived changes to their health. Okay, the second program that I'm going to talk about is the Fresh Food Prescription Program. This one happened in 2019-2020 in Guelph, Ontario. 60 participants were recruited, and they were each put through a 12-week intervention via a fresh food prescription. So this prescription was actually in the form of vouchers that they received from medical providers, and they could use these to purchase fruit and vegetables at their own choice. All of the surveys for the participants were done through a pre and post self-reported method. The part that I worked on for this program evaluation was actually working with the data that was collected from the healthcare providers and to get their perspective on what the perceived benefits and barriers of the program were. Okay, so now I'm going to talk about both programs and some of the benefits that were found. So both programs, so that's the Fresh Food Prescription and Transforming Tea and Toast, they were both seen to support the whole health, mental health, physical health, social and community health. Both programs provided fresh, high quality produce that really made people feel that they were worthy and part of the community. And this also supports just general dignity. Only the Fresh Food Prescription Program was able to provide complete choice through the voucher system where participants could choose their own fruits and vegetables. And only the Transforming Tea and Toast program was able to offer consistent delivery, which is very important for people who are struggling with mobility or need help with accessibility. Okay, I'm just going to talk a bit more about these. So this is a stock photo, just FYI, but I did meet with many people and these are their real stories. I just put in stock photos, obviously, to protect their privacy. So this one gentleman I spoke to, he lives on Vancouver Island and his daughter actually got him set up with the Good Food Box. And he said that the Good Food Box has been made an amazing change in his life. He said, since I've been getting the Good Food Box, my flare-ups have completely disappeared. I can't even begin to tell you how painful they are. So this gentleman is suffering from arthritis and he would get very painful flare-ups, but since he's been eating more fruits and vegetables, he says that has been managed. Okay, so both these programs are seen to promote and support mental health. All of the participants who are involved, they all said that getting out of the house, engaging in physical activities with others, the knowledge and skills, as well as the financial relief, all supported mental health. Here, the social worker with the fresh food prescription program said, the fresh fruit and vegetables are indirectly affecting their mental health in a positive way. People are less worried, less concerned financially. They know their food is coming in every week. Okay, and then we talked briefly about the support for community or social health. Many of the participants that I talked to absolutely loved the social and community aspects of these programs. I know one man said that he went to a Spanakopita class and he really enjoyed it. And many participants actually felt that the cooking classes and the other activities really brought them back and made sure that they stayed in touch with the program and were getting their fresh food regularly. I spoke with participant Y. She was in the TTT program, and she told me that it's always really good talking to the other participants when she would go down to the food hub. We usually talk about the community. We sometimes get together outside of that. And then I talked briefly about the fresh food. All of the participants were delighted with the high quality of produce, and they really felt that the freshness of the food really made them feel like they were valued members of the community. And I think you can contrast that with a lot of the issues people had had receiving food from the food bank, where they felt that the nutrition quality wasn't as high and there was an era stigma about it. And so a physician with the FFRX program said most of our participants just commented about the freshness of the food that they weren't able to access on their own. And then one more, oops, sorry. Okay, one more benefit is delivery that we talked about briefly. Delivery actually made a huge impact in a lot of people's lives. This one woman that I talked to at length, she is actually housebound due to illness. And she said that I cannot leave the house to chronic illness. So sometimes the only person I talk to in a week is the Good Food Box delivery driver. Even if it's only for 5 minutes, they totally make my week. All right, and then we're just going to quickly go over the barriers. Accessibility is a big one. A lot of people suffer from chronic conditions or they're quite elderly, so delivery is essential. Lack of culturally appropriate food. Both programs did not have the full variety people would like. The eligibility criteria, of course, the medical eligibility for the fresh food prescription box really limits people who want to participate or people who don't feel comfortable interacting with the medical system. And then, of course, because both of these are grant-funded initiatives, they have limited resources and reach. All right, so just a few limitations of food programs from the evaluations. So most of the benefits have been from low quality studies that have been shown to only produce results for a short time. Community-based food programs have not yet been proven to actually improve food security. Larger scale policy reform is of course needed to address low income concerns. And food programs have limited resources and are often staffed by volunteers. All right, and that is the end of my presentation. And I want to thank Professor Matthew Little for his kind guidance, Professor Jeff Masuda, my class professor, and of course, my family.